There's my baby.
I'm Dana Denha.
And I am Melissa Bondi, and this is Adventures in Parenthood, where we take a ride on the roller coaster that we call parenting.
Illnesses can run the gamut from mild to extreme. With kids, symptoms can show up in all kinds of ways, stressing us parents out with the uncertainty of it all. Melissa, have you had things like this happen with Bryn where you're like, or even yourself, honestly? I mean, medical stuff is complicated, and sometimes doctors struggle to figure out what's wrong.
Oh my gosh, Dana, that's the story of the last 9 years of my life. If anything, yes, she has had some, trips to the urgent care, ER, unfortunately. Everything turned out to be okay, but I have learned so much in the last 9 years with her, with myself, and being an advocate. We hear that all the time. You have to advocate for yourself, push it, doctors or whomever, tell you otherwise, push it if you need to. I've done that, and I've been successful in doing it. And so I'm very outspoken when it comes to that. Just, insisting. And if I am that Google mom, doctor mom, I am okay with it. Call me that. I'm okay with it.
You have to Google some stuff. When you're worried, you have, and guess what? Google knows a lot of information. So here's the deal. It happens. It happened to me. I had like a medical mystery, and then it took multiple, and guess what? Sometimes you got to switch doctors because they are not going to do it for you.
That too.
And you got to be like, I'm done with you. I'm not going back to this doctor anymore because obviously they don't care about my health and they're not listening to me. Yeah. So switching doctors sometimes has to happen. Other things, sometimes it's just you having a conversation and getting a deeper understanding. Recently, towards the end of the school year, there was multiple strep outbreaks at the school, and it was the second to last week of school. Kiki was sick, but it just seemed like your typical, just like a cold. Like I don't know about Bryn, but Kiki gets a fever when she gets a cold sometimes. So like she'll be running a fever during the first couple days of it. So I didn't think anything of it, but Rob, my husband, gets sick, and he's like terrible. He's terrible. And so he's sick for a day, and the next day he's like rubbing his neck like that. I'm like, what are you doing? Why are you rubbing your neck like that? Let me look at your throat. I look at it and I'm like, you have strep throat from Kiki's class. You need to go to the doctor because you can't get rid of strep throat without antibiotics. So then he goes, gets tested, he's positive. I take Kiki to the doctor because I'm like, he got it from her. The doctor's like, she doesn't have symptoms of strep, which she didn't. It wasn't showing up streppy for her. I go, give her the strep test. Give it to her. And she goes, I don't think it's going to be strep, but I will. Guess what? I was right. I'm glad I did it. And now our next guest is going to talk to us about, being that advocate and making sure that your family and yourself and your children are okay in a medical emergency.
Yeah.
Many of us may not know a lot about sepsis. Sure, we've heard of it. We know it can take lives. But how and why is it so dangerous? Sepsis can even affect children across the globe. Joining us is Tom Heymann, President and CEO of the Sepsis Alliance, and Dr. Marisa Louie, Clinical Assistant Professor of Emergency Medicine and Pediatrics at the University of Michigan Health. Welcome to the show.
Thank you.
Yeah, thanks for having us.
Can you guys first just explain what sepsis is so people that don't really know a lot about it can understand it a little bit better?
Sure. So sepsis is basically the body's overwhelming response to infection. So it might be a typical infection that starts off, but then the response is overwhelming.
Does it happen to certain people that maybe are like immune deficient? Is it more likely to happen to someone like that? Or like we were talking about children too. It seems odd. I honestly, when I was doing research, I thought it was odd that children suffered so much from it.
Sure. So children and kind of subsets of other patients are at increased risk for sepsis, but it can happen to anybody. So in particular, we think of babies, particularly those less than 2 months, at being at increased risk for sepsis. because you can think their immune system really hasn't been exposed to everything. And so they just don't respond appropriately. There are other patients too, for example, children who are on chemotherapy or have organ transplants who are also at increased risk, but it can happen to a completely normal person too.
Tom, can you explain what the Sepsis Alliance does?
Yeah, sure. Sepsis Alliance, we're a national patient advocacy organization, 501(c)(3) charity, and we were started, like so many organizations like ours, by a family that got hit upside the head by something they'd never heard of before. And in our case, it was Dr. Carl Flatley from Tampa, Florida, and his daughter Erin, 23 years of age, went in for what should have been a routine outpatient surgery. And this was in 2002. She was 23, perfectly healthy, and she was sent home without antibiotics. They assumed the surgery had gone perfectly well, and that was an assumption that turned out to be deadly. She got worse and worse. Her condition declined, and she was ultimately rehospitalized in septic shock and passed away. And that sent, Dr. Flatley, he was an oral surgeon, on a mission to really find out what just happened to my family. What is this? I'd never heard of it before. And what can I do to help other families avoid being hit by this? So we are all about educating the general public. Most sepsis cases start in the community. So think UTIs, cuts playing kids playing basketball. We also have a support community for survivors, many of whom have struggles after their survivorship. And we do healthcare professional education and training so that our HCPs, our healthcare professionals, have it more on their radar, given how common it is. And we do policy work as well. So we're a national organization really hoping to help, reduce the number of deaths from sepsis.
When it comes to children, are some of the most common infections that would cause this. My daughter, at the age of 3 or 4, I think, had a UTI. This was never mentioned. It sent her to the ER. Sepsis was never mentioned, but maybe we didn't get there to that point, but it was, cleared and whatnot. But what would be some of the other common infections that would lead to, in pediatrics?
Yeah, it can be any number of infections. We know sepsis can be a response to any type of infection, which a lot of folks don't know. It can be a bacterial infection, but it also can be a viral infection like the flu or COVID-19 or a fungal infection, which are becoming more common now with climate change, more fungal infections, and then a parasitic infection. So it can really be any kind of infection. And I think it's important for us as parents to really, tune in and know when kind of trust our gut. A lot of times we're afraid, no, I don't want to be the annoying parent, but to trust our gut. And I think, we just hear of too many cases. We had a young boy in Maryland recently passed away from flu-generated sepsis. And, the folks at the urgent care thought it was just the flu and sent him home. And that was an error. And he ended up dying 12 hours later, Lachlan DeSantis. So, I think we really need to be tuned in to something that not that many people know about. And we're trying to change that. And, what we tell people is it's a little hard to explain. Well, it's not really the infection. It's your body's response to the infection. We talk about it. It's kind of like a bee sting, using a metaphor. When you get stung by a bee, it hurts like heck, but it's not usually a real problem unless your body has that anaphylactic reaction to the bee sting. Sepsis is kind of like that. There's an infection, but the infection is not enough unto itself. It's your body's reaction to that infection that causes problems.
Yeah, Tom, I think that's a really good point. Like a lot of infections can look, like they're just limited to that. And sometimes it's really only time under observation or, really close, monitoring that really tells you that this is not just limited to that infection, that we will respond, quickly to the oral amoxicillin or something like that. It really takes some time to see what is the body doing in response to that infection.
Yeah, we developed a mnemonic, TIME, kind of, like stroke has FAST for early symptoms. TIME stands for, T is for temperature, high or low. It can be low or not necessary for someone to have sepsis, but it is often an indicator. Signs of an infection, which could be a painful urination with a UTI or some visible sign of an infection, but not always visible. A mental status change. They just weren't acting themselves, which is harder with a newborn or a young child, and harder with an older person who might have some dementia setting in. So but that is something we hear quite often. And extreme pain or discomfort. I felt like I was going to die. It's the worst pain I ever had. those symptoms mean that it's not something you can wait until Tuesday to see the doc. You really need to get seen quickly.
When you talk about pain, is it full body pain or is it dependent on where that initial cause happened? The virus, the UTI, whatever it might have been.
Sometimes I think it's kind of an achiness all over.
Almost like a flu feeling, like
right.
You feel achy when you have the flu or something along those lines.
Exactly. And, kids are amazing because kids can be sick with something and you give them a little Tylenol or ibuprofen and then they're running around the room. But when a kid is just laying on the bed and they're not really interacting, that altered mental status that Tom is talking about, that's really a big clue. And I would say altered mental status is actually probably one of the most worrisome signs and warning signs when you're thinking about someone who you're worried about sepsis.
Is there a point where it goes too far and the medical community can't really do anything anymore if you wait too long?
So we know that early recognition and initiating treatment always is better. Even patients who are at the severe end, so something that we call septic shock, that's when your blood pressure is too low. You're not getting enough blood with oxygen and glucose and everything to all the tissues in your body. That is a really severe condition. I would never say it's too far, right? We have different medicines that we give. We have blood pressure types of medicines to help raise your blood pressure. But certainly a patient who is at that stage is much more likely to have, kind of worrisome complications.
What about like the stats? Are we seeing a lot of child deaths in the U.S.? Is it higher for females? Is it higher for African Americans and Hispanics?
We do have statistics which are really jaw-dropping. In children, it actually takes more child lives than cancer in the U.S. And it's the number one cause of death for children globally. And actually, for all ages, kills more people than cancer globally. So, it's also a complicating factor of cancer. Many cancer patients are immunosuppressed, so they're more vulnerable to an infection. So there are nearly 2 million cases of sepsis each year in the U.S. 350,000 of those patients will pass away. So very, very high mortality rate. It's the number one cost of hospital care in the U.S. And it's the number one cause for readmission. So people who have been discharged from the hospital thinking they're well enough to be on their way, 40%, 2 in 5 are back in the hospital within 90 days. So it's a really challenging issue.
Yeah, I would agree. When you think about things that we spend a lot of time and effort and money preventing, things like pediatric cancers, motor vehicle collisions, like sepsis is right up there, but you just don't hear about it in the same way.
So you're talking about it like this is crazy to me that you're saying more people die from sepsis than cancer. That is blown my mind. You've blown my mind.
I know, Dana. I'm thinking the same thing. As moms, we don't talk about this with our mom friends. This is we had the flu and so had, this illness and hand, foot, and mouth. But we don't. When was the last time anyone mentioned this as a topic of conversation? It's not mentioned. I in my circle, in my friends, and I find this fascinating. Yet, what's
scary.
The word? Like
scary.
Very scary.
Yeah, and we want people, we say this often, we want people to be enlightened, not frightened. Because you can go down that rabbit hole of being scared of everything that happens to your child. And I think you just have to keep an eye on them. We have a family doctor in my town here in New Jersey, and she admits that it was not on her radar. She didn't really pick it up with her own son, who got injured playing baseball, had an internal infection, and was not himself. And took 3 days before she realized that he was talking about angels delivering a pizza to the house. That it was that mental status change. And fortunately, they got him to a children's hospital quickly. But he was in for quite a long time and has some lasting effects. But now she speaks on the issue and talks about how, as practitioners, as moms, as, parents, loved ones, we really need to have this on our radar as a consideration when someone is not right.
Yeah, and I think it's always important, to advocate for your child and for yourself. And so if your doctor isn't thinking of that yet, to bring it up. And it may be that there's very good reasons why they're not thinking about that because it's very unlikely. But, to have that explained, I think is really helpful. And I hope everyone's, pediatrician, primary care team. And then there's always the emergency department. Sometimes it takes a long time and is not the most pleasant place to stay. But there's always an emergency department open too.
Well, we're actually going to take a short 60-second break, and we'll be back with more on the Sepsis Alliance. We're back with Thomas and Dr. Louie. We were talking about sepsis. One of the big things that when I was looking at the website is, when you do go to the emergency room, we were just talking about that you might end up in the emergency room. But a lot of times it goes misdiagnosed at first. Why is that? Why are they not thinking that this is an option when you're taking yourself or this is a big deal for everyone across the gamut. Because when I think about when I became a mother, I feared for my own life a lot more. And I think that's a true statement for a lot of parents, where you worry about your own mortality because you want to be there for your kids, but you also really worry about taking care of these people that belong to you.
So I think the tricky thing with pediatric sepsis is it can be hard to detect. And it can look like a lot of things. So you hear a lot of patients that initially they just thought it was a urinary tract infection, or they just thought it was the flu or pneumonia. But then over time, things don't go as expected. Kids don't turn the corner very quickly. And some of the signs are really subtle. So, Tom brought up, what does sepsis look like in a baby who has altered mental status? That's really hard. And so sometimes it's really talking to parents and seeing what's your gut instinct right now? Does this seem like your baby? And again, watching patients. So sometimes we have to watch patients for a while to see where are things going? Does everything look a lot better now that the fever is gone? What is the baby doing? Are they eating more normally now? Are they playing and smiling at me and making eye contact? Or are they just kind of gazing off into space?
You guys also mentioned about the potential of having a high fever or a low fever, which is interesting to me because I feel like as a grown-up, I run a little low, so I know where my temp runs. When I take my temp and it's normal, I'm always in the 97-ish range. But when I take my daughter's temp or my son's temp, they're always pretty much more like the 98.7 range. So I do think okay, that's something to think about. If they're lower than they normally always are, then that's also got to be something that you have to think about too, which I don't know if I would have thought about that before reading. We were going to talk to Caitlin about Shayla, who has a story very much like that, where her daughter kept having a low temp, but it wasn't triggering anyone when she was taking she was taking her in. And that was really the indicator in the end that her temp was low.
We often talk about fevers, but we don't really talk about the low fevers. And sometimes it depends on how you check it too. So if you're doing, a surface temperature, maybe you're attributing it to the room being cold or just being outside. But kind of what we call temperature instability, so the inability to maintain your normal body temp, is definitely a sign that something's wrong.
You had mentioned earlier about kids having the flu. And then, is that part and becoming septic, is that usually what attributes when we hear about children passing away from the flu? Is it from the flu, or is it because they became septic and died from that typically?
It can be both. So the flu itself can be overwhelming. And like Tom mentioned, a lot of times it's not actually the infection, it's your body's response to that. So that alone can be overwhelming, but people with the flu can also get what we call complicating infections. So they have influenza and then they develop a very resistant pneumonia. Most of the time when patients look that sick, we end up giving them antibiotics, even if we're not quite sure yet if there's a bacterial infection. And again, because when the patient is that sick, you kind of want to be safe and kind of let them prove to you that this is not what's going on.
Okay. So as far as the Sepsis Alliance, and advocating, where are you out and about and trying? Are you in the hospitals? Are you in the schools? Do you, how does the marketing portion work with advocating?
Yeah, thanks for that. Given how prevalent sepsis is, we really, we're focused on a number of things. One is making sure that the general public knows about this as a medical emergency, the way we know about stroke or heart attack. It's more common and more deadly than both of those, and it can move very quickly. In most cases, start in the community. So I think that's job number one. When we got started, only 19% of the country had heard the word before. They couldn't tell you what it was. So we really had an awareness issue here. So we're at 69%. So we're making good progress and making sure people know the most common symptoms. So they don't wait. They don't say, oh, it's probably just a bad flu. I'll be okay. I'll tough it out. We hear those kinds of things all the time. So we do a lot of that work. And then survivor support and family member support. Surviving is not necessarily the end of the story. A lot of times, patients of all ages have ongoing challenges. They can be cognitive, they can be physical. 14,000 sepsis patients require amputations each year, and that's part of a result of your organs shutting down from the reaction. So, lots of long-term considerations. And then we do healthcare professional and education and training across the continuum of care. So that can include first responders who actually carry half of sepsis cases. So it's important for our first responders, who are in many communities are really your primary care, that they have it on their radar. So they know not to, when to suspect and take that person to the hospital and say, you know what, this person needs to be expedited. They may not look that sick. They're not bleeding from a gunshot, but they might, they should really be seen quickly. It could be as serious as a heart attack. So we also train school nurses who can be a first line of recognition. We have a school nurses training program. Folks who are doing home infusion, 3 million or more now, are susceptible to infections. Camp nurses, urgent care, emergency rooms, surgeons, OBGYN. Sepsis is now the number 2 cause of maternal mortality in the country. A lot of these are postpartum infections when the focus turns to the child and not the mom. So that's a big consideration. And in oncology and other disease areas where patients really need to be careful about being on the lookout for infections, making sure those are treated quickly so that we don't lose somebody who could benefit, live a long life with cancer. So it's really across the spectrum. And then educating our legislators, making sure that they know, hey, this is bipartisan. This is a number one cost of healthcare, and it's taking, more lives and more children's lives than cancer. You need to pay attention to this. Your constituents care about this, and you need to be making sure the government is responding appropriately.
That's interesting. When I had my first child, both my children were C-sections, and my mother was staying with me after I had her. And because you don't think about yourself after you have the baby. So you're not worried about your own health. You're like, I'm suffering. I just had a surgery, but I have a baby to take care of, right? So my mother's over and she goes, let me look at your C-section wound. And she goes, that thing is infected. And I had no idea that it was infected. I had no clue. And so we went to the gynecologist that day and I got on meds. But if she wouldn't have been there, I don't know how long it would have went.
Wow. Thank you, Mom.
Yeah, yes. So it is really important to just be aware of things, especially if you have a surgery or something where you could be maybe a little bit out of it because you're on meds or you're taking care of a child or you're doing this and that. And like a lot of times as a parent, your health does take a back burner. Like I had COVID and I had to take care of everyone because everyone had COVID. So I didn't get to rest. So it is thinking about these things that like maybe you don't think about your own health as much, but you really should.
Yeah, and I think a lot of moms are in a sandwich generation. You're taking care of older parents and young children, and who gets left out? Yourself.
Yeah, totally. And when you talk about, these complications from sepsis and people having to get their limbs removed, is this something that happens later? Like, okay, we got rid of the sepsis, but now there's an effect that happened maybe a year later.
Yeah, I think most complications are noted relatively soon, but patients with sepsis have really long hospital stays. And so things that kind of develop during that overwhelming response, like kidney damage, seizures, lung disease, those things, cause problems initially and then they linger for a long time. Things like limb amputations, those usually do happen during that initial hospital stay. And again, that's because your body is just not getting the nutrients and everything that's needed to these tissues that are kind of far off from your heart, so to speak. And so when those tissues start to die, they themselves now become part of the problem and sometimes need to be removed in order to save someone's life. So those types of things you'll see right away, but other things might take a long time. I'd also mention, like mental health. So, patients can have basically PTSD after these like really long, complicated, like disorienting medical stays.
Can you give us each a piece of advice for folks? What's the takeaway that you would give if you're talking to a parent or just the general public? What is your message?
So I would say just to think about sepsis. And if you're worried about it, but you feel like the doctor taking care of you is not, to ask them. Because if your gut is telling you something's wrong, then it's kind of your right and responsibility to say, like, why aren't you worried about that? And I think somebody, maybe they didn't think about it. And so now this might be the time that you've stepped in to help like save your child. But sometimes it'll be okay. And that's okay too, as long as everybody is thinking about it and understanding, like, why isn't it that? And what should I be watching for? Because maybe you go home with your antibiotics for urinary tract infection, but that's not the end of the story. Like, you need to kind of see how things go and then come back. And always asking your team and bringing up your family or loved one back to, someplace to get medical care is important.
Yeah, I agree with that. And I would say, infection prevention is sepsis prevention is our new tagline. And really it talks about if there's no infection, there can be no sepsis. So, we're not going to eradicate all infections, but there are things we can do. And that includes vaccinations, and very, very important. And, just good hygiene. And, if there are wounds, make sure they're taken care of. And, getting educated. This has to be on the list of things that know about. And if you do go to seek care, understand that healthcare professionals are busier than ever, and you can't count on them completely to think about all the possibilities. So, it's incumbent upon us to say, could it be sepsis? I was reading about this. Could these symptoms? And, not to get deterred, because sometimes you might meet somebody who doesn't want to hear from Google Doctor Mom, and so you really need to be an advocate. And sometimes that's really hard, some healthcare professionals are harder to work with than others. So you just have to be ready to do a little bit of advocacy. And, Caitlin's story was, really telling that she had to insist, and they found the lost lab that ultimately revealed that her child had a UTI, and it was a game changer in saving her child's life. So, educate, and get educated and advocate.
Yeah, Caitlin's story was almost frustrating to read with that test result being lost, honestly. And I do appreciate that you mentioned vaccinations, because that I did have written down and we didn't really talk about that. But it is important to vaccinate your kids to help protect them from things like this so it doesn't get so far.
Mm-hmm.
Yeah, no, absolutely. I think when people think about vaccines lately, they think about measles and the COVID vaccine, but many of our vaccines are actually directed at bacteria, and in particular, some that patients receive, very early in life, like during infancy, they were the cause of meningitis, pneumonia. Like physicians that are, like kind of now in retirement age will tell you stories of entire hospital floors filled with patients who all had pneumonia or meningitis. And pediatricians used to do LPs in their office sometimes because that was so common. And so the fact that now, like young physicians, that's not something they see very commonly is really due to those immunizations.
Thank you both for being on the show. It was really a great conversation.
Yeah.
If you have an idea for a parenting show topic or guest, talk to us at ctn@a2gov.org.
For more on our programming and our services, visit a2gov.org/CTN and visit youtube.com/CTN Ann Arbor and watch a full lineup. And remember to like, subscribe, and to share. And thanks for joining us on this adventure in parenthood.